Before we start the show, I want to thank and recognize our sponsor, Christy McCullough, and her Mobile, Alabama firm, Empowered Family Law, empowering families to navigate difficult changes and create new beginnings.
To someone who's just been diagnosed and who might be feeling something similar, I want to say that it does get better and don't give up. A lot of the struggle that comes with physical pain and illness isn't always just the symptoms, it's the way you respond to those symptoms. And I found that there is a natural grief that comes with losing physical ability, physical capacity, living with pain. But alongside that grief, there is also hope. And it won't always feel like it does right now. So keep moving forward. You might be able to accomplish more than you ever think you can.
Hey everyone, this is Rod Cade and welcome to this week's episode of Rocket Motivation. This week's guest is 23 years old. A couple of years ago, she began having debilitating chronic pain throughout her body, followed by muscle spasms, hands becoming paralyzed, loss of sense of taste and smell, and eventually seizures. She has been diagnosed as having functional neurologic disorder. This week's guest will talk about how she navigates life with her condition and how she deals with skepticism about her condition. Sydney Bennett, welcome to Rocket Motivation.
Hi, Rod. Thanks so much for having me on the show.
Okay. Hey, so Sydney, let's do this. Let's start with telling the listeners kind of where you are now in your life. Where do you live, family, kind of what you do. So kind of catch us up.
Sure. So I'm 23 years old. I'm married, just got married last March, so we're at 15 months now. I'm a junior in college, and my husband's in the military. So 4 months after we got married, he left on an 11-month deployment, and he just got back last weekend. So we're back at his station in Fort Riley, Kansas, and that's where we're living now till we go back to school.
Well, all right. Everything's going great, I would assume.
Yes, it's definitely great to have him back.
All right, well, let's go back to when your neurological symptoms started, and tell us about that. Mm-hmm. Tell us how it started and then how it's progressed.
So I had debilitating chronic pain for about a year. And I originally thought that it started from an old injury acting up because it was localized to my rib cage, but then it just started spreading throughout my body and becoming more and more debilitating. I couldn't eat. I was having trouble breathing, couldn't move very well, was speaking basically at a whisper because I couldn't raise my voice above a certain level. And no one could figure out what was going on. And eventually I was diagnosed with fibromyalgia. So about a year after that started, I got married and we were settling into our new life at Kansas. And then one night we were just driving back from a date about 2 weeks after a honeymoon, and my hands became paralyzed and I couldn't move them at all. So we went to ER, they ran a CAT scan, couldn't find anything, sent us home with my hands still paralyzed. And it just, one thing after another happened after that. The following week, I lost the use of my legs, couldn't walk, couldn't move them, lost sense of taste, sense of touch, ability to speak. I started having seizures and hallucinations and periods of unresponsiveness where I would just stop breathing. And we kept going back to ER. No one could figure out what was going on. And eventually the ER doc told me to stop coming back. And he basically said, I think you're probably dying, but we can't figure out what's wrong with you. And don't come back here because we don't have the equipment to help you. And so we booked an emergency plane ticket back to my home state in Washington. I got the testing done I needed, and a neurologist looked at my brain scans and said, well, it looks like you have some abnormal white matter in your brain, but nothing to worry about. I think all of this is due to stress, and I would diagnose you with functional neurological disorder. And he canceled all my other testing, and that was the diagnosis I got and was sent home. So after that, it took me months of research on my own to realize that even though I think he got the root cause wrong with stress, that functional neurological disorder is a real condition and how exactly it works. And that was actually my diagnosis, as it fits my symptoms quite well.
So what is that condition, functional neurologic disorder? What is it?
Functional neurological disorder is basically when your brain is not sending signals properly to your nervous system. So it has very similar symptoms to other neurological disorders, such as MS or Parkinson's. There's a lot of crossover. It's actually just as common as those, but all of the structure of your brain and nervous system is there. There's no structural damage, but somehow the wiring, the way your brain is communicating to the rest of your body is getting hijacked, and it's not communicating properly, which is what is causing those symptoms.
And so to diagnose it, though, so you go in, you get brain scans, you get CTs or MRIs, so they're normal. And so to diagnose it, does the neurologist, kind of put it together, kind of what your symptoms are, and then, but your scans are normal, and is that kind of how they come up with the diagnosis?
Yes, some of it is from ruling out other illnesses, such as multiple sclerosis, and looking at the scans. There's some things that are particular to functional neurological disorder, certain gait abnormalities that are specific to this disease, and the fact that the symptoms fluctuate. So I still have periods of paralysis, but it doesn't last forever. It's just temporary, and then I recover and I can go back to normal. And there's also something called Hoover syndrome, which is basically when the person has trouble moving a particular part of their body, and then the neurologist will distract them with another movement and have them try to repeat it, and it's easier when they're distracted. And that's also one of the criteria for diagnosing FND.
Right. I did a little research. Freud believed it was a conversion disorder because he believed it was a psychological disorder that converted into a neurological one. What's the present thinking on that?
Yes. So a lot of that thinking actually is still affecting the medical community and the stigma surrounding FND. And it started with Freud and his theory on hysteria. So you had people that were displaying symptoms of what was known then as hysteria, which included everything from epilepsy and seizure disorders to paralysis, any sort of neurologic dysfunction, insomnia, things like that. And all of that was considered hysteria a few centuries ago. Freud takes those things that don't necessarily have a medical explanation yet, and he talks about this theory called conversion disorder, which is basically that past trauma or history of abuse becomes converted in the brain to manifest in physical symptoms. And so for years, because there was no medical explanation for functional neurological disorder, it was called conversion disorder. And that's basically what doctors thought, that either it was all in the person's head or it was some sort of past trauma that was manifesting in physical symptoms. And that by treating the psychology of the person through maybe talk therapy or something along those lines, that the neurological symptoms would be healed. But that theory has been disproven in a lot of cases, as many people with FND don't have a history of trauma. And so it seems that kind of where we are in the medical field now is that first, many doctors are still not aware of how FND works. It's still heavily under-researched and thankfully is coming into more research in the last few decades. But also that in trying to figure out how trauma works, it seems like perhaps trauma might be a trigger in the brain, but is not actually the root cause. And we don't understand what that root cause is yet.
Right. And going back to when, like, you would go see, like you told us about the emergency room physician who's basically told you don't come back. I mean, is there some skepticism with this diagnosis and have you experienced this, that people think, well, look, there's really nothing wrong with you. You're okay. And this is just all in your head.
Yes, definitely. While my husband was in deployment, I actually had to call the ambulance twice because I couldn't breathe or move. I was stuck in my apartment on the floor. And when the paramedics came and they took me to ER, I was told that, there's nothing wrong with you. I started having a seizure. And while I was seizing, the ER doctor told me, sit up and listen, out of frustration, even though it was completely outside of my control, because they couldn't see anything structurally that would be causing a seizure.
Yeah. Well, and outside of even the medical community, what about, just maybe friends or family? Have they been have skepticism, at least at some point, about, well, is this really something real?
Yeah, I think one of the hardest things for people to understand is how much the symptoms can fluctuate, because I can go from being, totally fine, moving normally, talking normally 1 minute, and 5 minutes later, I could be completely unresponsive or not able to move. And so I think when people see that, it doesn't seem to fit into a clear category of sick or disabled or healthy. It seems to be very fluid between those categories, and that's really hard for people to understand. So sometimes there can be frustration there, or even on my Instagram account where I talk about disability, there's people that, accuse me of faking for attention, or this doesn't make sense. You're either disabled or you're not.
Right. I mean, you sometimes use a wheelchair or a cane to get around, right?
Mm-hmm. Yes, yeah. It just depends on what my symptoms are.
Well, and do you get questioned about that? Because I guess you could go in a wheelchair and then get up and walk. Do you ever get questioned about that? Or people like saying, well, what are you even using a wheelchair for?
Oh, yes. Pretty much every time I go out and I'm using a mobility aid, I get questions, especially because I'm a younger person. And so most people assume some sort of injury and they want to know, what happened to you? What's wrong with you? And so when you start talking, they realize there's something else going on, and it definitely evokes a lot of questions or confusion when I go from a wheelchair to standing up or walking.
Yeah. Well, how do you deal with that? How do you deal with the people kind of questioning you, like, why are you in a wheelchair? You came in here in a wheelchair and now you just got up and walked. Mm-hmm. How do you deal with that?
It used to really get to me. It used to be something I was insecure about, even using an aid out in public. It was something I really struggled to have confidence in. And I would start second guessing my own symptoms when I was feeling better. Like, okay, maybe I wasn't as sick as I thought I was, because now look, I'm able to walk okay. And as I've needed to educate myself more on this illness and how it works. And as I've studied that, I found that over 95% of wheelchair users are ambulatory. They can walk. And so the stereotype that if you're in a wheelchair, you're always in a wheelchair is completely false. It only applies to less than 5% of cases. So most disabilities are what's called dynamic, in that the symptoms fluctuate. And I've needed to learn that whatever mobility aid helps me at the time to manage those symptoms is what I need. And it doesn't really matter what people think. I can politely and kindly inform someone if they're asking or if they're concerned. But at the end of the day, I don't need to justify my use of a mobility aid to someone who's not willing to understand.
Well, yeah, this is your life, and whatever makes it easiest for you to get somewhere, it's that you don't have to go around justifying it to other people.
Right. Yes, exactly. And a lot of that has come down to acting more confident than I really feel inside. When I'm getting stares, my natural reaction is to kind of want to recede into myself and disappear. And so by smiling and standing up straight and trying to walk with even more poise and confidence than before, it started to kind of instill more of those feelings in me, to where I'm not pretending as much to be confident.
Right. I mean, is there any type of therapy or treatment that you undergo?
There is, yes. So with functional neurological disorder, every case is different. And because we don't completely understand how it works, it's kind of throwing a bunch of paint at the wall and seeing what sticks. And so most of the treatment comes down to some form of cognitive or physical therapy. So I've done EMDR, which was treatment for my PTSD, which was influencing some of my seizures. And that probably helped the most. My seizures went from up to 10 a day to now probably averaging between 3 and 7 a day, which was a big improvement. I've also done cognitive behavioral therapy, which is kind of identifying your triggers and learning how to navigate your symptoms better. And I've done physical therapy, which I probably saw the least amount of improvement with, but it definitely does help a lot of people.
Yeah. Now, I think you said earlier in the show something about it helps when you're distracted.
Yes.
Oh, tell us about that.
Yeah. So the theory behind that is it's the conscious channels in your brain that are being hijacked. And so if I'm looking at this cup of water beside me on the table and I'm thinking, I need to reach out for that, my brain starts freaking out and it doesn't know how to send those signals. But if I'm distracted, either talking to you or I'm focused on something else, it's easier for me to reach out and grab the cup of water. And the same applies for walking. Sometimes I'll misjudge the distance and my walking will start to deteriorate. And, I don't know if I'm going to get stuck or if I'm going to need help. And I'll try distracting myself by singing or reciting something just softly to myself. And the distraction actually helps me to walk better because I'm not focused so much on walking itself. It goes back into the automatic part of the brain.
Well, that's interesting because, and you and I talked about this, with me with my spinal cord injury, when I'm walking with my cane, it can be difficult for me to get around and to walk. But if I don't think about picking my feet up and doing the next step, if I'm just like thinking about something when I'm walking, the next thing I know, I'm there without thinking about it. So
Right.
it's just so amazing how the brain works and what it can do.
It really is.
So how was your condition? How has it affected your life?
At the beginning, it was very difficult. And there was a lot of emotional whiplash, too, in a way, to go from just being married and all of this life change to, oh, you might be dying, to, oh, there's nothing wrong with you and it's just stress. And then that process of understanding what was actually going on and my diagnosis. And then 3 months after all of those health things starting, my husband needing to leave on deployment. And so it wasn't just becoming used to a new disability and a new body in a way. It was, how am I going to navigate this all on my own? And that was very difficult. And what I found was probably most difficult was not just the symptoms themselves, but my emotional processing of the symptoms. I was really struggling mental health-wise with depression and anxiety and just trying to figure this out, feeling very isolated. And I think that this last year has really grown me in that my symptoms aren't necessarily much better than when they first started, but they've become much more a normal part of my life that I'm able to navigate. I know that when I become paralyzed or when I'm feeling awful or when I have a seizure, it's not the end of the world. I'm going to come back out of it. And I can let that ebb and flow and work my life around it. So I'm able to mentally process and cope with that much better. And it's not as much of a struggle anymore.
And so how do you live your life with your symptoms? What do you do?
Yeah, school was probably the most interesting. I'm on summer break now, but I needed to let my professors know, I have a seizure disorder. If I leave class, because I can tell when a seizure is coming on, if I leave class, that's why. When I come back to class after, I might not be able to speak right away. And so if you call on me and I can't answer, that's the reason. And I probably left once every class period and would lock myself into the bathroom stall and just have a seizure on the floor and recover after and go back to class. And there were days when I wasn't able to get to school. Living in an apartment on my own, sometimes I would have what are called drop attacks, where I could be walking and then all of a sudden my brain stops sending signals to my legs and I would just fall onto the floor. And when that happened, I would tie my backpack of books to my leg and army crawl over to the bed so I could study there because I wasn't sure when I'd be able to walk again. And so there were a lot of crazy things that happened that I just needed to figure out as they were happening because there was no way I could have prepared for them. And now that I'm out of school and I'm back with my husband, managing the symptoms have been a lot easier because I'm not on my own anymore. But it's really just understanding first your own bodily limitations and, what's triggering, what's pushing too hard. If I push too hard and pretend I'm not sick, then my symptoms get worse and it forces me to stop. So it's better to know early on, okay, I can tell my symptoms are starting to get a little worse and I need to take a break now. And learning that pause and that rest is okay and it's a good thing was one of the biggest challenges, but also one of the best ways that I found to help manage my symptoms and get as far as I have.
You live a fairly active life. In other words, you're not sitting around doing nothing waiting for your condition to improve, right?
Yes, that's definitely true. And I'm realizing that if I'm waiting for my condition to improve, which I have no idea if it ever will or not, then I'll be spending my whole life waiting. And so it's much better for me to have goals outside of my illness and learn to work my symptoms around those goals rather than waiting to be better to accomplish what I want to.
Yeah. How important it is to you to be living in the now and not trying to wait until things potentially would get better?
It's honestly one of the biggest ways that I can cope with what's happening because my natural personality, I'm very much of a planner. I like to know ahead. I like to be in control. And what this illness has forced upon me is the realization that I never have been in control. I was very active before I got sick. I would walk 5 miles a day just for fun, trained horses. I was going on hikes and doing all of this stuff on my own. And I reveled in that and I loved that. And it felt like I was in control. And then I got sick and literally overnight, all of that goes away. And I realized that I never was in control, but those things weren't the most important thing about me. And the things that I'm wanting to do and the things that I'm accomplishing in going back to school or traveling, those look different than I expected them to because I'm needing to structure it around my illness. But I'm learning better how to live in that uncertainty and not knowing what's going to happen, not knowing if I'm going to get better. And that makes it so much easier because I can surrender that and then focus on finding joy and strength in the now.
Yeah. I mean, what if your symptoms don't drastically improve? What's your plan?
My plan is to just keep going as I'm going already. So, I want to finish school. I love writing. I love public speaking. I want to pursue a career in both of those things. I'm starting my own business. I'd love to start a family one day. I'd love to travel and see more things. And so far, I've been able to start the process or do many of those things with the condition that I have right now and the condition that my body's in. And so it would be wonderful to one day get better. Sometimes I think, that's all I want. But I can't live my life waiting for that. And I know that there is a way I can accomplish those things, orienting my symptoms around that instead of surrendering everything to my physical condition.
Yeah, right. What message would you give to someone who's been diagnosed with the functional neurological condition? What advice do you give to them?
When I first was diagnosed, I tried to find community, and I probably wasn't looking in all the best places, but what I found was honestly a lot of people who are very depressed and hopeless. And it just confirmed this belief that I had in myself that my life is over. Like, I'm never going to be the same again. I'm never going to be able to do the things I want. And it was almost harder to realize that my illness wasn't terminal in a way, because I thought, it's just going to be like this forever and it's never going to get better. And so to someone who's just been diagnosed and who might be feeling something similar, I want to say that it does get better and don't give up. A lot of the struggle that comes with physical pain and illness isn't always just the symptoms. It's the way you respond to those symptoms. And I found that there is a natural grief that comes with losing, physical ability, physical capacity, living with pain. But alongside that grief, there is also hope. And it won't always feel like it does right now. So keep moving forward. You might be able to accomplish more than you ever think you can.
Yeah. What have you learned about yourself in dealing with your condition?
Like I said before, that I'm not in control, and that's actually a good thing. I've also learned that strength and courage aren't feelings, and that sometimes when I'm strongest is actually when I feel the most weak. And sometimes people will say, it's great that, you're disabled and you're still working or you're still in school and, you're doing these things. You should be so proud of yourself. And I'm so thankful I've been able to do those things. But the hardest battles that I fought and the battles that I'm most thankful for have been fought flat on my back in bed. And that's something anyone can do. And when I felt weakest, it hasn't been digging into this, this strong feeling or courage that I've just felt in myself. It's been falling on the Lord and being held up by the people around me and realizing that I can keep moving forward and doing the right thing, even if I feel like that's impossible. Just take a breath and do the next right thing.
What do you mean by when you say like the toughest battles were the ones that when you were flat on your back?
Like in school, navigating those symptoms or working even with paralysis or seizures, that has been difficult. But the most difficult moments have been when it's nighttime and I'm alone in bed and I can't sleep because my whole body's in pain and I'm having seizures or hallucinations and these thoughts that are like always going to be this way, and you're just stuck in this, and aren't you so frustrated? Don't you just want this to be over? And it's pulling out of those moments when you feel the weakest that are the hardest battles, and those are the battles that no one sees. And so if someone's disabled and they're not able to work or they're not able to go to school and they feel like, wow, I'm not strong or brave because my disability is stopping me. It's like, yes, your disability will completely alter your life. And it might actually stop you from doing things, and that's okay, because the strongest, hardest battles where you are going to be the strongest and bravest isn't necessarily in accomplishing all those things that everyone else sees. It might be in the things that no one else sees when you're by yourself, and you have to tell yourself the truth over and over, even when everything else seems to be screaming a lie.
Yeah. Hey, and I want to broaden the question about, what advice you would give. I want to broaden that out a little bit because, the Rocket Motivation is all about overcoming adversity. So what advice would you give, based on what you've been through, and not just advice you would give to someone who's been diagnosed with FNC, but just, people that are down or having bad luck, going through some tough times and they need some help or they need to, to get out of it. What advice would you give to those people?
Just practical advice that I've used on myself. First, someone told me never to believe what your mind tells you at night. And I've definitely found that to be true, especially if I'm struggling mentally, is nighttime is prime time for your brain to start saying a bunch of lies, and don't listen to those. Wait till the morning. Things will become clearer then. Don't give up. Keep going. Don't make any long-term decisions when you're in that low spot. And there's going to be a lot of ups and downs. And when you're in the down again, it can feel like, oh, I'm back where I started. But you're not. You're like 50,000 downs from where you first started. And each one is progress, even if it doesn't feel that way. And then also trying to find joy in the little things will be a total battle. But one of the things that really started turning my mindset around is audibly going over things that I'm thankful for. And what I found is this actually taps into the science of the brain. But if you're believing something, your brain will start looking for things in life to confirm that. And so in my mindset at the time, it was, life is horrible. I'm tired of being in this disabled body. I'm sick and in pain all the time. This isn't getting better. And every bad thing that would happen, my brain would highlight that and use it to confirm my belief. And so when I started to go over things that I was thankful for, even when it was really hard at first to find just 2 or 3, it started slowly shifting that mindset. And pretty soon my brain would actually start highlighting the good things. And I could rest in those and think about those. And then finally, just finding community, finding people who can support you, people who you can talk to, so you're not in that isolated place all on your own. That made a huge difference. So definitely very important to find community there.
Absolutely. And the way I found you to become a guest on the show is on Instagram. I saw some of your posts and I just thought, wow, Sydney would be a great guest on here. One thing is obvious that you don't hide from your disability, what's going on. You put it all out there and, it looks like you're trying to help other people that have your condition. So if somebody wants to follow you and, keep up with you and learn from you, how do they do that?
Yes. I have an Instagram account at the_Ann_Girl or the.Ann_Girl, and spelled with an E. That's my Instagram handle, and you can follow me in there. I post a reel every day and stories just walking through what it's like to live with a disability, and not just functional neurological disorder, but chronic illness, chronic pain, disability in general.
Yeah. And I've looked at it. It's some really good stuff, very inspirational and also just very kind of pragmatic advice. It's really good stuff you put on there. But, well, Sydney, I want to thank you so much for coming on the show. It's just been an absolute pleasure. But, before you go, though, and I do this every show, I give the guests the parting shot. So, although you've given us quite a bit of wisdom already and advice, give us something good that you can take us home with.
Thank you. I would just say that there are going to be times in your life that you'll feel this is it, and I don't know how I'm going to move on from here. And one of the best pieces of advice I've actually gotten for in that moment, first, you've reached the end of your own strength and you need to rely on the Lord and on other people to help you through that time, because you don't have all the strength in and of yourself. But then second, it actually helps to go through the motions and just keep doing the next right thing. Just take a breath, keep moving forward. And it will feel like you're faking it, like you're faking life, you're faking happiness, you're faking being strong. But as you keep moving forward and doing the right thing, it'll feel like you're faking it less and less. And especially if you're able to reach out and help other people, that's probably been one of the biggest ways to break out of, that mental cycle and that introspection, or, that really tough thing. When I feel as if, I don't have a reason for why I'm going through this, someone will message and say, you made me feel less alone. And it's made me wonder at times, maybe I didn't go through this, to learn some grand lesson in myself. Maybe I went through this for that person. And finding ways to help other people, to serve others, to keep moving forward in your life, those are one of the best things that can come out of your struggle.
Right. Okay. Well, Sydney, I want to thank you so much for coming on. We wish you the best. And this has been a fantastic show. It's been my honor having you on.
Thank you so much. It's been a pleasure being here.
Great episode with Sydney Bennett. For such a young person, she has great insight and wisdom. It's got to be tough dealing with a neurologic condition that is difficult to diagnose, and one that leads to skepticism by some who question, is there anything really wrong with her? Next week's guest is Steve Serio. He is a 4-time Paralympic medalist for the USA men's national wheelchair basketball team. He's going to tell his story of giving up crutches and braces for a wheelchair and how doing so opened his world. It's going to be a great show. See you next week. So thanks again for listening to Rocket Motivation. I want to again thank our sponsor, Christy McCullough, and her firm, Empowered Family Law. Listeners in the Mobile County, Alabama area, get in touch with Chrissy and Empowered Family Law for all your family law issues and needs. If you would like to get my book, Get Back Up, it's available at Amazon. Just put in Get Back Up and my name, Rod Cade, and the book will pop up. I'd appreciate it if you would subscribe to Rocket Motivation wherever you listen to your podcasts. And please rate and review the shows and spread the word about Rocket Motivation to your friends. So until next time, remember, never give up and always get back up.